This is Chapter 19, Part 2. We're moving on to hearing impairment. About 2 out of every 1,000 infants are born with a permanent hearing loss. And that means we have about 1 million children in the U.S. who have hearing loss. Now, we differentiate between deaf and hard of hearing. Deaf means there's a hearing disability that makes them unable to have successful processing of linguistic information. So they cannot hear enough to ever be able to communicate with language, with hearing. Hard of hearing, there's enough residual hearing there that we can use a hearing aid, and that would make them able to successfully process language that they hear. Now, etiology, how do they get this? Well, prenatal or postnatal conditions, things like family history, anatomical malformations in the ear, low birth weight puts them at higher risk, severe perinatal asphyxia or perinatal infection, chronic ear infections, and that's one of our big contributors there, kids with CP or Down syndrome, or kids who have had ototoxic drugs. And if you remember your mycins, those are antibiotics that are ototoxic, so we need to be careful with those. And then environmental noise can damage hearing. So pathology, there are several different types. Conductive, which is also middle ear hearing loss. Remember, our outer ear and then our middle ear is where we've got the 3 bones, and that's where we get our otitis medias. This is the most common type of hearing loss, and the most common cause is recurrent or chronic serous otitis medias. So these kids are having to hear, there's supposed to be air in there, and instead there's fluid, so it's like hearing underwater. Everything is distorted. They just don't hear right. Sensory neuro, this is the inner ear. After the middle ear, hearing is changed to nerve conduction at the little hairs, and then up, hairs in the cochlea, and then up the nerve. And so that's where a sensory neuro hearing loss happens. This can be damage to that inner ear structure or to the nerve. It often is congenital, or it can also be acquired. There should be a comma between congenital and acquired. It can be either. Some of the causes, connectorus, which is from that high bilirubin, remember? Infection, ototoxic drugs, loud noise levels can all cause sensory neuro hearing loss. And you can have a mixture of both, conductive and sensory neuro, so middle and inner ear problems. And this can happen from recurrent otitis media as well. Now, central auditory imperception means there's nothing wrong with the ear. The hearing in the ear is normal. There's something wrong up in the brain. The brain does not perceive the sounds that are being brought up there to it. So how do we treat this? Well, conductive hearing loss, often while you have a hearing, or while you have an otitis media going on, you don't hear well. So we treat the otitis media. If it's turned into a permanent problem, then we need to do a hearing aid. And any child who isn't saying mama, dada, making those well-formed syllables, the consonant vowel, by 11 months, they need to be referred to an audiologist and checked for conductive hearing loss, or hearing loss in general. But that's kind of a critical time. The last half of the first year and up through the second year of life, these kids are learning so much from what they hear, so we really need to get these kids hearing. Now, if we have a sensory neuro hearing loss, hearing aids don't work very well. If it's mixed, then we may still be able to use a hearing aid, but if it's at the nerve, amplifying it out at the middle ear isn't going to help, because the problem is at the inner ear. There is something called a cochlear implant, where they basically make the cochlea, which is your inner ear, and instead of using the little hair cells in the cochlea that then send the nerve or the sounds up the auditory nerve, we have this cochlear implant that does that. If we can get that done for a child by 18 months of age, it's much better, because then they can start hearing. There is a lot of controversy in the deaf community, though, about cochlear implants. The deaf community is a strong community that support each other and really don't see a need for deaf children to become hearing children. So anyway, even with a sensory neuro hearing loss, we're usually going to have some difficulty in articulation. Even if we do a cochlear implant, they may not have totally normal sound when they speak. Now, visual impairment. This means visual loss that cannot be corrected with regular prescription lenses. On kids, well, on most of us until we're over 40, near vision is almost always better than distance vision. And legally blind means that your visual acuity is 20/200 or worse. So that means what you see at 20 feet, the average person could see at 200 feet. So 20/40 is what you have to be 20 feet from it, but the average person would be able to see it 40 feet away. That's how those numbers work. So if we can't correct their vision better than 20/200, they're legally blind. So let's go over some of the terms that have to do with visual acuity. Myopia, this is nearsighted, which means you can see things close, but you don't see things far. This is our most common kind of problem that we're correcting. And as that light comes through the eye, through the pupil, through the lens, and then is directed onto the retina, the place where it is focused is in front of the retina. And so we do this with corrective lenses, glasses or contact lenses, or surgery. We have surgeries now that can fix this. Hyperopia, this is the opposite. This is farsighted. So you can see things far away but not close. And that, as the light comes in the eye, it would be focused behind the retina. And again, we can correct this with glasses, contact lenses, or surgery. Trauma, remember your mom saying you're going to poke your eye out? Well, that is a common cause of blindness in children. And astigmatism, there's an unequal curve either of the cornea or of the lens, and so it makes things distorted, sort of like looking in one of those funny mirrors. It makes you tall in part of your body and short in the other part. That's what an astigmatism is. It's the same sort of idea. It's a curve, weird curves, and we can fix this with corrective lenses, and we're getting good at surgery correcting things like this. Amblyopia, this is often called lazy eye. This means that you lose vision in one eye over time. For some reason, there's something going on in the eyes where the brain is getting two entirely different images from the two eyes. So the brain will take the stronger eye and use that image, and it will slowly over time ignore the weaker eye, and the weaker eye will get worse and worse and worse and worse until it no longer has vision. So we want to correct this before age 6, and we need to correct whatever the problem is that's making the two eyes have different vision. Often it's that they're crossed, or they're exotropic, going, I don't know what a different term for that, but the opposite of cross. They're going out opposite directions, or they're misaligned. One goes up and one goes down, or one has really poor vision and the other has good vision. So whatever the problem is, we need to correct that. Sometimes they use patching in this. It just depends on what the underlying problem is. Now, strabismus, this is misalignment of the eyes. Usually one is higher and one is lower, and you'll see those kids, they tip their head to the side because that makes things level. But anyway, so we have a misalignment usually of the muscles pulling the eyes in different directions. You can also have the crossed or the exotropic. And with strabismus, usually what we'll do is the patching. And we patch the stronger eye in order to make the child use that weaker eye to avoid amblyopia from happening, to make that weaker eye get stronger, and function well. And depending on if it's just a muscle balance thing and we can strengthen the muscles, that may be all that's needed, but we may sometimes need to do a surgery for this. Now, cataracts are not just an old person problem. You can have congenital cataracts, so cataracts that develop in utero, and this is opacity of the crystalline lens. So the lens inside the eye, instead of being see-through, it's cloudy. You can't see through it, and this requires surgery. That lens has to be removed and a better lens put in. And it's kind of amazing, kids who have these congenital cataracts. I knew a family that had several kids, and about half the kids had it. It's amazing. They had poor balance. It affected so much more. You don't realize how important vision is in developing all the other milestones. Deaf-blind children. This is very profound on a child's development. We can't really teach them sign language, so if they're cognitively high enough functioning, we can do finger spelling, use the sign language letters, but do it where they can feel it on their hands. If they do have a little residual hearing and sight, they usually can learn to speak. But these kids probably are going to require lifelong care, either by parents or in a residual care facility. Retinoblastoma, this is a tumor on the retina of the eye. What you see is a whitish glow in the pupil. They'll call it cat's eye reflex. And the treatment, it's just based on how progressed the tumor is. I think that's a good stopping spot.